It's one of the world's most contagious diseases, and it's back.
Children are the most susceptible to both infection as well as to complications, including death from measles.
Two cases of measles have been confirmed in New York City, the first of 2025, and health officials are on high alert. Now, we know so far that both cases are in children and are unrelated. Measles is a highly contagious virus that spreads through the air when an infected person coughs or sneezes. According to the New York City Department of Health, up to 90% of unvaccinated people exposed to the virus will become infected. Experts say measles typically begins with a high fever, runny nose, cough, and red, watery eyes. A rash usually appears 3 to 5 days after the first symptoms, starting on the face and then spreading to the rest of the body. In 2019, New York City experienced a significant measles outbreak with 605 confirmed cases. Last year, there were 50 reported cases of measles in New York State, with 14 of them occurring in New York City.
And because we're seeing outbreaks now in Texas, New Mexico, and Canada, we want to make sure all New Yorkers are protected and that they have their MMR vaccine.
Now, the most effective way, according to experts, to prevent measles is through the measles, mumps, and rubella, or MMR vaccine. 2 doses are recommended, the first between 12 and 15 months, and the second between 4 and 6 years old. Currently, 81% of toddlers in New York City have received their first dose of the MMR vaccine. Health experts recommend that at least 95% of the population be vaccinated to ensure sufficient protection against outbreaks. And it's not only New York City. New Jersey has reported at least 3 cases in Bergen County, including a patient who was unvaccinated and traveled outside of the United States. And that's not all. In Texas, over 140 cases have been confirmed since the end of January, with 1 death being reported as of last week.